Today I'm going to explain what narcolepsy is, what causes it, how it affects the brain, and how it's diagnosed and treated. Narcolepsy is a chronic neurological sleep disorder where the boundaries between wakefulness and REM sleep become unstable. People can suddenly fall asleep, dream during brief naps, or experience REM-like symptoms while awake. There are two types. Type 1 includes cataplexy, which is sudden muscle weakness triggered by emotions. Type 2 has all the sleepiness symptoms but no cataplexy. Common symptoms include excessive daytime sleepiness, sudden sleep attacks, cataplexy, hallucinations, sleep paralysis, and fragmented nighttime sleep. Symptoms like excessive daytime sleepiness and sudden sleep attacks can make everyday life extremely challenging. People may struggle to stay awake in class, during work meetings, or even while having conversations. Tasks that require focus or quick reactions become difficult, which can affect school performance, job reliability, and confidence. Cataplexy adds another layer of difficulty. Because episodes are triggered by strong emotions like laughter, excitement, or anger, many people start avoiding social situations or try to suppress their emotions to prevent collapsing. This can feel isolating and frustrating. Hallucinations and sleep paralysis can be frightening, especially when they happen frequently. They can create anxiety around bedtime and worsen overall sleep quality. Fragmented nighttime sleep also contributes to constant fatigue, mood changes, and cognitive brain fog during the day. All of this impacts emotional well-being. People with narcolepsy often face misunderstandings, being labeled as lazy or unmotivated, even though their symptoms are neurological and beyond their control. Safety is also a concern, especially when sleep attacks or cataplexy happen during activities like cooking, being in public, or driving. Overall, narcolepsy affects far more than sleep. It shapes how people move through school, work, relationships, and daily life, and it requires understanding, support, and proper treatment to manage. Now that we understand the basics of narcolepsy, let's look at the root cause of it. Narcolepsy is caused by the loss of a small group of neurons in the brain that produce a chemical called orexin, also known as hypocretin. Orexin is responsible for maintaining stable wakefulness and preventing REM sleep from occurring at inappropriate times. In narcolepsy type 1, the immune system mistakenly targets and destroys these orexin-producing cells, which is why the condition is considered autoimmune. A strong genetic marker, HLA-DQB1*602, increases susceptibility, and for many people symptoms begin after an infection or immune stressor. The loss of orexin creates a permanent instability in the sleep-wake system, leading to the symptoms people experience. Without orexin, the brain cannot effectively coordinate the systems that keep us awake. Several wake-promoting regions, like the locus coeruleus, the raphe nuclei, the tuberomammillary nucleus, and the basal forebrain, lose their normal stimulation. This leads to persistent sleepiness, reduced alertness, and difficulty concentrating. At the same time, the regions of the pons that control REM muscle paralysis become unstable, allowing REM features to intrude into wakefulness. This causes symptoms like hallucinations, sleep paralysis, and cataplexy. Narcolepsy is essentially the brain slipping between wake and REM states because the system that keeps them separate is damaged. Now let's go over how it is diagnosed. To diagnose narcolepsy, doctors look for a combination of symptoms and sleep study results. The first test is usually an overnight polysomnography, where brainwaves, breathing, and muscle activity are monitored while the person sleeps. This rules out other sleep disorders. The next day, they do a multiple sleep latency test, or MSLT. During this test, the person takes several scheduled naps. Doctors measure how fast they fall asleep, and whether they enter REM sleep unusually quickly. People with narcolepsy often fall asleep in under 8 minutes and may enter REM sleep within minutes. In some cases, doctors also test cerebrospinal fluid for orexin levels. Very low orexin strongly supports a diagnosis of narcolepsy type 1. Although there's no cure yet, narcolepsy can be treated by managing symptoms. For excessive daytime sleepiness, doctors prescribe wake-promoting medications, like modafinil or stimulants. For cataplexy, sodium oxybate and certain antidepressants help reduce sudden muscle weakness. Scheduled naps, consistent sleep routines, and avoiding alcohol or sedating medications also help people stay more stable during the day. New research is now developing orexin-based therapies, such as OX2R agonists, which aim to replace the missing orexin signal. These treatments are still in trials, but they could become the first therapies that actually address the root cause of narcolepsy. Thank you for watching.